Welcome to a new episode of non-invasive positive pressure ventilation. I'm going to talk about weaning and weaning in the acute settings. We're not talking about weaning of somebody who's using his CPAP for sleep apnea or a COPD or who use BIPAP at home. We just talk about somebody with acute CHF and we put them on CPAP, or acute COPD exacerbation, we put them on BIPAP. So first, think of weaning as soon as possible. Try to wean them of that as soon as possible. Second, treat underlying problem. Treat underlying CHF, treat underlying COPD exacerbation. The next things now, while you're rounding on them, is their APG improving? And you're close to your goal? Is the patient clinically improving? And if you see these things, and the patient is hemodynamically stable, of course, there's two ways of weaning. So coming down on the values or giving them breaks, frequent breaks, and you prolong the break. Let's say I'm going to give you a break for 30 minutes. The patient tolerates that. Next time I'm going to give you a break, like let's say every 4 hours, I'll give you another hour. And that way. I prefer, let's say somebody with acute CHF, let's say put them on CPAP 15 and 100%. Start treating problems. I see their O2 improving, their respiration improving. I come on this, let's say 70%. I repeat ABG, APO2 is good. Then I come 10, 5, and keep coming in this. And at one point, if it's 5, or sometimes even I take them off that. But try 5, they're tolerating at 5, and this down to 50% at least. I say, okay, time to take you off that. Keep it standby if we need you to be back on it. And of course, I've treated their underlying problem. COPD exacerbation, so you put somebody on 15/5. Everything is improving here. You can, for example, 12/6. I tried not to change the delta P, keep it, and the worst case scenario I can say, hey, okay, let's say 12/5, and if they are tolerating this and tolerating also the FiO2, okay, let me give you a break. In COPD, I prefer the break scenario rather than coming down on the values. Give them every 4 hours, 30 minutes, then another hour, then 2 hours, then switch it to bedtime. And if they are doing okay, we can completely wean them of that. So it can be individualized, but you can follow this or follow this, the breaks, or follow both at the same time. But try to take them off that as soon as possible. If you're having any difficulty with that, of course, you can consult the pulmonologist to help you with that process. But it's simple and straightforward, really, if you understand. If you're treating the underlying problem, understand how this machine works. And remember, keep the machine standby, especially in the first 24 hours after they're weaning completely of them, in case they need to go back on them, because whatever you do, still there is some failure rate. Thanks for watching this video. Please subscribe to our channel and activate the notification bell so you get to see the videos as soon as they are released. Glad to have you on board.